To speak with us today, we have Dr. Bill Moorcroft from Northern Colorado Sleep Consultants. Welcome, Dr. Moorcroft.
Thank you. Thanks for this opportunity. I always love to talk about sleep and dreams and to help people understand more. So thanks for having me.
It's our pleasure. Dr. Moorcroft, you have studied and researched sleep and dreams for 50 years now, as well as authored 5 books. What led you to this path, and what is your approach to treatment?
Well, when I was doing postgraduate research at Nebraska Medical School in 1971, I
Mhm.
attended the first International Congress on Sleep Research in Belgium. That piqued my interest in sleep, so subsequently, as a college professor, I created a sleep lab in which I did research on sleep and dreaming. And then when I retired from teaching about 15 years ago, I started helping people with insomnia sleep better using non-drug behavioral methods.
How interesting. How have you seen the issues individuals are having with sleep and treating their sleep disorders change over the years?
Well, we in the sleep field have continually learned more and more about sleep and sleep problems and how to treat them. Major examples include just gaining an understanding of what sleep is and how the brain controls it. We're going to take a look at that in a little bit here. And then learning that there was something called sleep apnea, and eventually how to treat it with CPAP, and then how to treat insomnia with non-drug methods. And these are just a few things that we've learned. We've come to learn how important sleep is.
Mm. Sleep, I
And
believe, is so much more important than most people realize.
yeah, and there's a lot that can go wrong with sleep. For example, not sleeping enough, disruption of sleep, poor sleep at night or and napping, inappropriate timing of sleep, and all of these can lead to daytime problems. Those problems include difficulties with attention, memory, and mood, plus poor impulse control, hyperactivity, and others. But to put it more positively, sleep yields a lot of benefits, including attention and memory, executive functions, that is, controlling what we pay attention to and how we execute it, mood, impulse control, and many other things too. Now, it's important to realize that sleep is not a simple shutdown of the body and the brain, but rather a functional change in what the brain is doing, changing from the daytime mode of doing things like gathering experiences, information, and skills to doing things offline, so to speak, that it can't do when we're awake because it's so busy doing those other things, but yet there's important things that need to be done. So when we sleep, we filter memories because some things are not important enough to keep up with, but other things are important and those are strengthened. And then also bringing emotional balance to us. And those are the 2 main things that happen in sleep, very important and necessary. And there are other things too that happen during sleep. Importantly, with regard to insomnia, it's better to have the resources inside of you that you need to sleep rather than to rely on something external, such as a drug or substance for sleep. You get better, more natural sleep that way. And most people can learn how to sleep naturally from a behavioral sleep therapist such as me, thus not needing anything external to themselves to help them sleep, such as drugs or substances.
Mhm. Sleep is something we hear so much of from our clients, and I'm so glad that you're here to share so much of your insight with us. In the last couple of years, well, 2020 and also now in 2021, there have been a lot of events that have taken place causing us to lose sleep. What are some holistic methods one might use, or can you walk us through what drug-free behavioral solutions look like?
Yes, to answer that question, though, we need to be aware of just what sleep is,
Mm.
because it's more complicated than most people believe. So this is what we have learned. Excuse me. We have two opposing brain mechanisms to control sleep. One is sleep need, and it gradually increases when we're awake, as if there's an hourglass that fills up with sleepiness when we are awake. And it accumulates this sleepiness. But when we go to sleep, it's as if the hourglass turns over, and that accumulated sleepiness now begins to trickle away. But that's not all there is to it. It also interacts with a timer that tries to keep us awake during the day, but allows sleep to occur at night. So this is like a time function. But yet there's still more than that. Think of sleep as coming out of the bottom of a funnel. And there are behaviors and situations that enter the top of the funnel. And while some of these can help sleep, importantly for insomnia, there are factors in our situation and our minds that interfere and keep us awake when we would like to be asleep. These additional factors are the main source of problem for the vast majority of people suffering from insomnia.
Mhm.
That is, the things that hinder sleep are just too strong. Now, behavioral treatment for insomnia involves learning to weaken the situational and behavioral factors that hinder sleep, thus allowing the brain's biological sleep regulators, the first two things there, sleep urge and the clock, to operate freely.
Mhm.
That is, almost all people who suffer from insomnia have the ability to sleep, but there are things hindering that in their situation, in their mind. Behavioral therapy for insomnia shows them how they can weaken those interfering factors. This means for most people, the solution to their insomnia is not to look to things outside of themselves, such as drugs or substances, to sleep well, but to learn how to remove those interfering situational and mental things that can interfere with their natural sleep. One of the major things that people with insomnia have told me is that their minds are active, keeping them awake. So we teach people ways to control their minds so they do not keep them awake. Now, this is just one example. There are other factors, but it is a very common one. So the therapy for this, however, needs to be done on an individual basis. So I cannot give you the details right now because everybody's a little bit different and have to be approached differently. But most people without behavioral help will continue to suffer from insomnia, and it may even get worse. Another thing, in the age of COVID, there's a lot of people who are finding that anxiety is interfering with their sleep, either general anxiety or anxiety about having trouble sleeping. To help these people, we use a form of guided mindfulness meditation, specifically designed to help with insomnia. This has been so successful that I have written a book called Mindfulness for Insomnia. that helps people accomplish this on their own. This book is available from all booksellers. There's also audio editions. And recently, in fact, just this week, I got these copies that has been translated into French and into Russian.
Well, that's excellent because there's people all over the world. I don't know of anybody who has not suffered from insomnia at one point or another, which brings me to my next question. Is this just for adults, or is insomnia something that can begin early in life, say for toddlers?
Oops. Messed up my screen here. Give me a
That's
second
okay.
to get it back. Um,
You can take your time.
Yeah, I'm not sure what happened here. Well, anyway, let me answer your question.
Sure.
I've worked with 6-month-olds up through people in their 80s to help them sleep. Now, it's a little different working with children than it is. Start my video. Okay. Is that corrected now?
Well, we're not sharing screens anymore, but it's you and I here.
Okay. Back to share screen. Now is the screen on? The share
It
screen?
is, but probably
Okay.
not your slide that you had on before.
Oh. So you're not seeing the book covers?
No.
Oh.
We're seeing recommended tools for you. Maybe it's another tab.
Well, anyway. So I was talking about, I worked with 6-month-olds up through people in their 80s. The most common children I've helped are 2-year-olds, interestingly enough. The parents complain they don't sleep through the night. They actually are. Everybody wakes up a few times during the night, so sleeping straight through the night really doesn't occur. But what happens with these children is they wake up and they fuss until somebody helps them get back to sleep. So what we do is work with the parents so that they know what to do to teach their children how they can sleep on their own. It usually takes a week to 10 days, which is actually much quicker than the 1 to 2 months that it typically takes to help adult insomniacs.
It took my kids about 18 years. I should have known about you back then.
I've heard that a lot.
Well, on your website, you have one article where you talk about 10 mistakes people make that can ruin their sleep. Would you mind sharing what some of those mistakes are? Oh, there we go. We have your book in Russian.
Okay.
And
Yeah,
French.
I found the right thing to click there.
Okay.
So you were asking about mistakes that people can make.
Yeah,
There isn't
you
time to
list
talk.
10, but perhaps you could share just a couple with us.
Right, sure. I think the most important factor is for people to keep their sleep times regular, especially when they wake and get out of bed. This helps keep that timing mechanism that we talked about, that clock in our brain, helps to keep it regular. If it gets irregular and disrupted, then sleep problems can emerge, insomnia can emerge. Another thing to do is not to take seriously wearable devices that purport to give us feedback about our sleep. To put it bluntly, they're not very accurate. You see, insomnia is actually a subjective problem. It is awareness that a person has of what they're experiencing with their sleep or not experiencing sleep. It's not something that any device or test can objectively measure. Yet for too many people, the device purports to tell them what their sleep is, and people falsely believe this. And then too often they think they have insomnia or other aspects of poor sleep when they really do not. So what you're experiencing is the best measure of how your sleep is, and not what some device tells you.
Mm. Or perhaps how you feel the next day. That's usually quite telling about if you got a good night's sleep or not.
That's very true, because insomnia is not only a nighttime problem, it has carryover effects on the next day, like we showed on the second slide earlier, that there are problems of not sleeping well.
Mhm. Well, this is so fascinating, and we could talk for so long. I would love to hear just a little bit about dreams as much as time allows, because this is also in your realm of studies.
Sure. Uh, Dreams are a natural phenomenon. Uh, the average sleeper who sleeps, let's say, about 7, 8 hours a night, is getting up to a couple of hours of dreams in during that time. We cycle in and out of different types of sleep. Most people have heard of REM sleep, and then there's non-REM sleep. And we dream when we're in REM sleep, and it totals almost 2 hours a night. So we may have several dreams every particular night. And it turns out that they're very beneficial for us. They help us with that emotional leveling that I was talking about earlier, that sleep can do for us. And dreams are the main way that occurs. Now, the content of dreams can be pretty bizarre, as everybody realizes, and pretty unusual. They're created out of our minds. So our minds can be very creative, and it picks up bits and pieces of our experiences from the past, and also maybe fabricate some things and puts them together in unique, interesting ways, and sometimes scary, and they can lapse into nightmares. But by and large, they're very helpful to us and very good. Now, we don't have to remember our dreams in order to analyze them and get benefits out of them. It's okay if you do that. It's very time consuming, but we only remember a small percentage of our dreams anyway. And so it's not, they're giving the benefit that we need without our having to analyze them. So those are a few things that we've learned about dreams. Sorry about my.
Fantastic.
Okay.
I find dreams so fascinating. In your opinion, your professional opinion, do you find that it changes the quality of our sleep at all, whether we remember our dreams or not?
Well, we do know that what you are dreaming about and you wake up and you realize you've been dreaming can affect your mood, and especially if we have a nightmare. But there's no evidence that while we are sleeping, that the content of our dreams can interfere with our sleep, unless perhaps it's a nightmare, which is very frightening, and we start moving about and reacting to it. Does that answer your question?
That does. And I have one last question because I realize we do have a limited amount of time. Um, do you find that dreams are meant to be insightful in any way?
They can be. Like I say, we remember just a small percentage of our dreams, but it can be interesting and insightful to analyze those dreams. It takes a lot of time to do that. And I write about that in one of my books, a whole chapter on how to do dream interpretation. And I think that the best way to do it is for each of us to analyze our own dreams. So you don't have to go to some expert who knows how to interpret what you're dreaming about, because you create your dreams out of your own experience. And so you're the best one to know what the dreams mean. However, it does take some skill, some technique to learn how to analyze your own dreams. And so that's what we can help people with. The method of getting at what their dreams mean to them rather than telling them what it is. So we give them the way to do it rather than tell them what the dream is about.
I believe wholeheartedly in this. Dr. Moorcroft, for any of our clients or community that are watching today that might be interested in getting help with sleep or even looking into their dreams more, does your practice accept virtual appointments?
Yes, we do. But I personally am cutting back as I ease into retirement. As you mentioned in the very beginning, I've been focusing on sleep for 50 years, and it's about time for me to segue into retirement. However, my colleague, Natalie Roll, is very active and working with people via telehealth. She doesn't do the dream part, but she can help people with insomnia. And this is some of her contact information.
Fantastic. Thank you so much for meeting us today and sharing about sleep. Like I said, I don't know of anybody who has not struggled with sleep at one time or another. So your expertise and information is so very helpful for us. Thank you so much for joining us.
You know, Lisa, it's hard to be perfect. And that applies to sleep too. Almost everybody has an occasional poor night of sleep, myself included. But I know what to do when I have one so that it doesn't continue on and become insomnia. So yes, it's true. Everybody experiences occasional poor nights, but it's those people where that is a dominant part of their sleep and their experience. Those are the people we like to help. So it's been a pleasure to speak with you, and you've had great questions, and we've had a great conversation here. Again, I thank you for the opportunity.
Thank you so much, and thank you, viewers, for joining us for another segment of Care Team Chronicles. We'll see you next week.